Okay, I think we're good to go. Okay. All right, welcome to the Behavioral Health Agency WAC Survey Results webinar. And we're taking a little bit of a risk here in using some newer technology that I haven't used before. So we're going to try it out in hopes that we can make this webinar a little bit interactive. And that being said, there's always a chance that it's not going to go as planned, but we're going to try our best. And there's a few things that you can do to help us out with this. So first, we are muting everybody so that there isn't a lot of background interference. If you could also try to mute the line on your end, that would be great. Just make sure not to put us on hold, because sometimes we hear hold music in the background. So we're going to have a few polling or voting questions later on in the presentation that we'll ask you to participate in. In order to participate, you're going to have to be logged into the webinar. So if you are on the phone only, that's okay. Just know that you won't be able to actively participate in those questions. So if you want to, go ahead and log on to the webinar. There's also maybe some times if we have enough time during our webinar that I may ask you to participate in some discussion. Because everybody is muted, the way you can participate in the discussion is either by typing in your comments or questions in the chat box, or if you want to speak out loud, you can raise your virtual hand. You should see somewhere on your screen a little hand that you can click on to raise. Or if you can't find the hand and you still wish to speak out loud, you can type that in the chat box, and we will do our best to try to unmute you so that you can talk. So in addition to sharing, can you go to the next slide, please? There we go. Oh, also, you may have seen that little origami bird fly across the screen. So we're using a new version of PowerPoint that had some fun little animations that we included on the slide just to keep things light and fun. But the intent of this webinar is that in addition to sharing a summary of the survey results with you, the goal by the end of this presentation is to actually have a basic work plan for our big WAC project. To develop that with you during this webinar. So we'll try to scope out our work, break the work down by topic, and then determine the order that we're going to tackle the topic. So that's where the interactive piece of the webinar will come in. Next slide, please. So I always like to start with a little bit of background, especially for those of you who maybe haven't been on the past webinars, and I think it helps sort of remind us of where we came from. So there was a House Bill 1388 that transferred behavioral health licensing and certification to the Department of Health. And so the behavioral health rules that DSHS used to have authority over came over to Department of Health in emergency rule status. And in order for us to do anything super fun and exciting with these rules, we had to move them from emergency status to permanent status. And so we gave ourselves a target date of accomplishing this by early 2019, and we were able to do that and completed that piece of the project in April of 2019. So once that phase 1 was completed, we then planned for phase 2, which was our overhaul project, immediately following last legislative session, the 2019 session. And we weren't totally able to meet that goal, but there was a really good reason for that. So in the 2019 session, what came out of that is that we were required to open our behavioral health agency rules specifically to implement what we refer to as House Bill 1394, or the Governor's Facilities Bill. And so we're currently in the middle of that project. You can find more information about that online if you're interested. Next slide, please. But there was an impact in us having to do that implementation work. So that work did delay our ability to open up the chapter for our big overhaul project that we were planning on because there are rulemaking rules. And so one of those rules states that you can't have multiple rules projects working on the same WAC sections. So for example, if we have a rules project open where we're doing some work on the definitions section, that takes that whole section of WAC and makes it off limits for any other rules project. So as you can imagine, this can get a little bit tricky. So because we had multiple sections of the WAC open for this 1394 implementation work, we had to delay our big overhaul project until we complete that 1394 project. And we committed to doing that project very quickly. So our goal is to complete that in 9 months. So far, we are on track for that project to be finished in May. And so in the meantime, while we were working on that project, we asked you all to engage in some pre-work assignments that would allow us to continue to make some forward progress on our overhaul project, despite delaying the official opening of the chapter for the big overhaul project. So your first pre-work assignment was to participate in the WAC survey. So on July 24th, we held a webinar that introduced the survey. And the intent of the survey was really to gather some high-level feedback from the participants regarding Chapter 246341 WAC, which is the Behavioral Health Agency WAC, so that we could use that data and information to inform how we might organize our large overhaul project. So the participants in the survey were asked to indicate section by section if the current language caused no concern, some level of concern, or a high level of concern. And the participants, if they chose, could also leave additional information, comments, or explanation of why they were concerned and what their suggestions were. So that survey was open from July 25th through August 23rd, so about a month. And we had a great response. We had over 850 participants. And there was about 130 participants that answered every single question, and about 730 participants answered some or only the questions that were applicable to them. And those partial responses were totally expected, since we know that all of the WACs in the chapter do not apply to every agency, and participants were told in the instructions that they could skip the questions that didn't apply to them. So that 730 partial responses was something we totally expected to see. And we also were able to capture some information about the variety of participants as well that you should be able to see on your screen. So the results are in, and the results of the survey ended up being about a 170-page report full of great information. And I read through it several times, and I analyzed both the qualitative and the quantitative data that we received from doing the survey. And for this presentation, I'm only going to be able to share a summary of those results, but I will be posting the full survey results with just some personal information redacted on the Department of Health webpage in the next week. And when that post goes live, that link goes live, I'll send that out to you all via GovDelivery so that you can go in and look at the full results. So while I'm only going to give you a summary during this presentation, what I think is really important that you know is that all of the data, all of the comments in every WAC is going to be included in our big WAC overhaul project. So if your comments or your WACs of concern aren't covered today, it doesn't mean that they're going to be ignored. They will still be part of our big project. Just for time's sake, I am not able to go over all the results that were in that 170-page report. Next slide. Okay. I like the honeycomb. Okay, so these are the top 10 WACs of concern, and I had somebody that's much more skilled in Excel help me make sure that the responses were weighted so that they were more meaningful. And so the results that you see on the screen are in the order of most concerns or highest concerns. And so you'll see peer support services was the top, and then we had the agency staff requirements, wraparound services, the definition section, assessment components, deeming, peer support, mental health services, record content, evaluation and treatment services, and youth residential services are the top 10 WACs of concern. If we'll go to the next slide. Here's just a little graph that shows you actually the top 25 WACs of concern and sort of how that broke down. So the peer services definitely came out on top, and since most of you probably don't have the WAC numbers memorized, on the next slide, I did break it down by WAC title for you. So in addition to those top 10 WACs of concern, these are the rest of the WACs that made the top 25. So I'll give you a second just to look at those. Okay, we can go ahead and go on. All right, so what I want to do now is jump back to focusing on those top 10, just to give you a flavor of the types of qualitative data that we received. So the bullets on these next slides are just a summary of the themes that I was able to identify in the comments that came in. And again, we'll be sharing with you that full report, so you'll be able to view the full comments on your own as soon as that's posted. So for peer services, the main comments that we got were that the recommendation that agencies should not be required to have certification for this service, and that peers should not have to be supervised by a mental health professional. Next slide. And all right, so for agency staff requirements, lots of concerns and suggestions that we really need to clarify the scope of practice. There's lots of reference to scope of practice, and we need to make sure that that's clear and that everybody understands it. And also that we should add co-occurring disorder specialists and references to applied behavioral analysts and peers in this WAC section. For the wraparound services, the comments were that this WAC is not necessary and there is way too much detail in it. And part of that stems from there's already a lot of contract language and guidance around this particular service. And then for the definition section, lots of concerns with the definition of clinical supervision, also definition of clubhouse, approved supervisor, CDP, which needs to be changed to SUDP, and CDPT. There needs to be consistent definitions of adult and adolescent, youth, child, minor, etc. There's missing definitions of MHP specialists, the mental health care specialists, and then also some clarification needs to be made about critical incident reporting. For the assessment WAC, lots and lots of comments about too much documentation, and I know this has been a hot topic for a while now, so I'm really excited to dive into that and figure out how to make that better. But also this WAC section needs to support telehealth. And the next one is on deeming. Comments were that deeming should mean less DOH oversight. We should explore agreements with other accrediting organizations such as Clubhouse International, and then comments that MCOs should be the ones that do the audits for deemed agencies. For peer support mental health services, peers should be able to be supervised by peers. And then a suggestion that we should clarify that peers with lived mental health experience serve individuals with mental health conditions, and peers with lived substance use disorder experience serve individuals with SUD conditions. All right, and then for the additional record content, we need to remove duplicative requirements. Not all of the requirements in this section apply to all services, and that needs to be taken into account. And then lots of comments that the requirement for counselor disclosure isn't clear. For the evaluation and treatment services WAC, we need to include language about long-term commitments, which, just as a side note, our 1394 implementation work is doing this. So I think hopefully that'll be an easy box to check off. But there should also be language that includes requirements for therapeutic and secure outdoor spaces, especially for those persons that have those long-term commitments and will be in the facility for a longer period of time. And then this last one rounds out our top 10. And this is for youth residential services, asking us to clarify change in status, emergency discharge, and appropriate authority. So that just gives you an idea of the types of comments we received specific to each WAC. And then there were some themes that appeared over and over again in multiple WAC sections. One of the questions on the survey at the end, towards the end, was also like, leave us comments about anything you want. And so I went ahead and pulled those themes out and put them in this slide. So definitely lots of comments that there needs to be more peer services and more peer involvement. We need more use of applied behavioral analysts. There needs to be less documentation. We need to fix deeming, the deeming process and what that means. We need to clarify scope of practice and credentialing requirements of staff. Clarify clinical supervision versus supervision of non-clinical services. We need to support telehealth. We need to support co-occurring services. We need to create consistency between the mental health and substance use disorder requirements. We should consider less regulation of behavioral health, making it more like physical health regulation. There needs to be an increase in reimbursable services, and we need to fix our fees, which I totally agree with. All right, and I think, let's see, what time is it? I think I'm doing pretty good moving through these slides. So we can pause here for just a few minutes or so. Is there any questions that you all have based on the information I just gave? You can type it in the chat box, or you can raise your hand and we will attempt to unmute you. Okay, it looks like Mary Stone Smith has raised her hand. So we unmuted you on our end, Mary. It says you're self-muted. So if you'd like to speak, you can go ahead and unmute yourself and ask your question.
Thank you. This is really helpful. Oh, can we have an echo, just a sec. We're turning it down. On the WAC for crisis, the first one, 0920, you mentioned that the concern was about a peer counselor reporting to an MHP. We actually, or being supervised by an MHP, we completely agree with being supervised by an MHP, but the WAC says ensure that a peer counselor responding to a crisis is accompanied by an MHP. And that's for us where the issue is. They're often accompanied by a master's level clinician, but it may not be an MHP master's level clinician. So I just wanted to clarify that.
Yeah, yes, and that did come through on the WAC survey as well, multiple times, and I've heard that in other conversations. So yes, that particular concern we will definitely talk about when we do the work.
Thank you so much.
Yeah, you bet. And then it looks like Crystal Liebert, and you are unmuted. Okay. And we're not hearing anything from you, Crystal. Okay. All right. So does anybody else have their hand raised, or we'll just go to the comments now? Okay. So we have one question in the cleanup. Let's see. Oh, we have not gotten to that slide yet. So we will hold your question because we have not covered that information just yet. Okay, any other questions? Will the slide deck be distributed? Yes, we will send the slide deck out. As soon as I have the link to the full survey, I'll send all of that information out to you all. Okay, I think we can go ahead and move on to this next slide. Okay. All right, so the buckets of work slide. This one's going to take me a little bit of time to explain, so just bear with me. So as I was analyzing all of this data and sort of sorting it out in my mind, I realized there's kind of like 3 buckets or levels or tiers or whatever you want to call it of work. And they're all important and they're all necessary to give behavioral health policy and regulation, I think, the new look, feel, and impact that we want it to have. So we definitely, as we work through this large project, we will address all the work that needs to be done in all 3 of those buckets. But bucket 1 is we have sort of this body of work that is just cleaning up the existing language in the chapter. So this would include things like cleaning up terminology, adding some clarifying language, removing redundant requirements and the things that don't make sense, fixing references. And then there's a couple of things that would be lumped into bucket number 1 that I call one-offs. So for those of you that have sort of been following peer support services, substance use disorder peer support was added into the Medicaid state plan, but we don't yet have rules for that, and that's been on sort of Department of Health to-do list. And so that's an example of a one-off that we would just lump into this first bucket of work, is addressing some of those things that have been on the department's to-do list. And then if you zoom out a level, then we have the second bucket of work that really consists of reorganizing the chapter. So we got comments in the WAC survey about, well, can't we lump certifications together? Like, why do we have to have, you know, all these individual certifications? Can't we just lump it together, since most people providing these services are doing all, you know, let's say all 3 services? So that's an example of reorganizing the chapter, would be like grouping services together if that made sense, considering adding new services or certifications that would be appropriate. And then we have this third bucket of work. So if you zoom out like at the 30,000 foot level, there's this big bucket of work that consists of cleaning up and reorganizing all of the behavioral health WAC chapters. And so that would include the residential treatment facilities WAC, the psych hospital WAC, the chemical dependency WAC, and potentially even doing a little bit of work within the acute care hospital WAC chapters. So that we can create consistency and efficiency and get rid of duplication that may exist in all of those different WAC chapters, just to simplify things so that they make more sense. So I hope that that makes sense and you're still here with me, because we're going to, I'm going to need your help in scoping out our project. So I use the super corny analogy because it helps my brain think through things, but we need to be mindful of how much we bite off at a time in this project so that we can avoid excessive lengths of chewing and potential choking hazards depending on how big of a bite we take. So this is where you come in. So we'll go to the next slide and I'll explain this a little bit. So this is, we're going to get to our first polling question here in a second. So when you're answering this polling question, I want you to keep in mind that for each bucket, it's about a year's worth of work, give or take 6 months or so. So for example, if we wanted to tackle buckets 1 and bucket 2 at the same time, that would most likely be about a 2-year project, start to finish. Again, we're going to get to all of the buckets at some point during this project. I'm just trying to scope out like our initial work, how big of a bite are we going to take, knowing that that's going to impact our timeline. This is the new technology that we're going to try out. So we are going to launch a poll, and the question is, how many buckets or how big of a bite do we want to tackle at one time? Do we want to start with only bucket number 1? Do we want to try to do bucket number 1 and bucket number 2 at the same time? Or do we want to try to tackle all 3 buckets at once? So I'll give you a few minutes to go ahead and answer that question. Asking, can we see the list of what's in each bucket again? Are we able to go back to that slide again and still have the poll open? Yeah, there we go. This is fun. It looks like it's working. Okay. We'll give it about 15 more seconds. Okay, it looks like the poll slowed down and we had 75% of you logged in voted. So I'm not sure if you can see the responses, so I'm just going to read them. So we have about a little over 50% that said start with just focusing on bucket number 1 initially. 31% of you said start with buckets 1 and 2. And then 16% suggested tackling all buckets at the same time. And now we have about almost an 80% vote rate. So this is super helpful and I think provides us with some clear direction on how we're going to start. So starting with a smaller bite to bucket number 1. Okay, we're just going to quickly read through the questions real quick. Oh, asking, did it return the bucket to the content slide? We did. I'm not sure if you can see it. Okay. Okay. All right. So let's go ahead and go to the next slide here. All right, workshops. So this is just some more background information that's going to help you when you answer our next polling question. So the next thing I'm going to want your feedback on is how we're going to organize the workshops. So for those of you who did participate in our 1394 legislative workshops, you have sort of an idea of how we prefer to run the workshops. And for those of you who didn't attend, I'm going to share a little bit of a description with you of how it typically works. So the workshops are open to anyone to attend. And they usually have an in-person and a webinar option. At least all of ours, yes, they have we try to do both whenever possible. Very rarely do we have only in-person or only webinar. But at the workshops, the Department of Health and the participants, we collaborate and we review and draft the WAC language together. And at a workshop day, we often break it up into sessions, with each session focusing on a specific topic. So for example, during our 1394 rulemaking, each workshop day consisted of a morning session, which focused on intensive behavioral health treatment facilities, and then an afternoon session that focused on mental health peer respite centers. And this allowed participants to either attend just the session that applied to them, and maybe that was just, say, mental health peer respite center, so they were able to just come in the afternoon or call in the afternoon. But for some people, they were interested in both topics, so they were able to just stay the whole day with us and attend the full workshop day. So the goal really in organizing our workshops that way is to be able to move through a couple of topics simultaneously when possible, and then use all of your time efficiently, because I know you have jobs and you have clients and you have really important work to do. And so we don't want to take up all your time, but we still want to make sure we maximize your ability to participate in our workshops, because you're sort of the voice that we need to make sure that we get things right. So, so we try to be mindful of how we organize our workshops so that you can participate. Another thing to know about the workshops is they're typically scheduled as a series. So very rarely can we tackle all of the work that we need to on a single day. So this means that there's usually a series of workshops scheduled for a given topic. So for the 1394 work, we had a series of 6 workshop days that were scheduled. And the workshops in the series are progressive. So that means that while we're going to discuss the same topic at each of those workshops, the agenda is built off of the progress that we made at the previous workshop. So that's a little bit different. Sometimes you may see different programs where they have 4 workshops, but the agenda for all 4 workshops is exactly the same, and you can pick one day to go to. But for the work we're doing here and the amount of work we have, and because I think it's important that all participants are able to participate in the same discussion at the same time, I think there's a real benefit to that. We like to do our workshop series as a progressive series. All right, so next slide. So with that description in mind, I want to talk a little bit about the best way to break down our topics in order to maximize your ability to participate in the workshops. And there's all kinds of ways that we can slice and dice this. So I've done a lot of thinking about this, and I've looked at the way the WAC chapter is currently organized by topic. I've looked at the data from the survey, and then just pulled from my own experience with behavioral health and policy work. And so I have a general idea of how I think we can break down the work by topic area. So, so these are my thoughts up here on the screen. So one topic area I see is a general requirements topic. So these are the general WAC requirements that apply to all of the agencies, regardless of which services they're providing. And there's plenty of work there to make that its own sort of standalone topic. The next topic I see is peer services. And the reason I see this as its standalone topic is I think there's a lot of unique and special things about peer services. And there's also a lot of work that needs to be done there. So I see that as a topic in and of itself. The next topic that I see is the recovery support and clubhouse services. And the reason I see this as sort of its individual topic, even though I know that there's going to be overlap, like with peer services, but the reason I see this as its own topic is because and I try to refrain from using this description because I know it's not very Medicaid compliant, but those tend to be the more non-clinical services, which I think have some unique things and potential carve-outs that we want to may want to explore for those service types. And then opioid treatment programs and problem gambling, I think those services are pretty unique in and of themselves and would be standalone topics. So that was my original thought. But then we get to this part where I have a little bit of a hang up, and this is where I'm going to need your help. Go ahead and hit one more time. So I think for the remaining topics, there's sort of two different ways that we could break them down. We could break it down by inpatient services and outpatient services is one option, or we could break them down by substance use disorder services and mental health services. So if you'll go to the next slide, this next slide basically says the same thing, only I wanted to get rid of all of the extra information as we're thinking through this. So I'm going to try my best to explain and create sort of this visual for you. So pretend that Department of Health is sending out an agenda for a workshop day. We could do, on the agenda, we could do mental health inpatient services, say in the morning, and then we would do substance use disorder inpatient services in the afternoon. And once we complete that work for that series of topics, then we could move on to doing something like outpatient mental health services in the morning and outpatient SUD services in the afternoon. All right, so that's one option. So the second option is pretend we send out a workshop day agenda, and we set it up so that we do substance use disorder inpatient services in the morning and then substance use disorder outpatient services in the afternoon. Once we get through that work, then we would move on and do like mental health inpatient services in the morning and then mental health outpatient services in the afternoon. So there's benefits to doing it both ways, and I know that's probably a little bit confusing, so I hope you're able to visualize it a little bit. But there's benefits I see to doing it either way. With option A, I saw a benefit is that it may make it easier to identify where there needs to be consistency between mental health and substance use disorder requirements, because we're sort of looking at both of those topics on the same day. And it may make it more natural to think in terms of co-occurring work because you're focusing on two topics during the day rather than just a single topic. With option B, though, the benefit is that we would have more of a narrow focus on the specific area of behavioral health, where it would just be a day that was all focusing on substance use disorder and a day that was just focusing on mental health. So those are the two options I see for breaking down the rest of the work that we have to do into topics. So we have some comments. Yes. Okay, good. We'll get to those comments here after we do the polling question. So here's the polling question, I think. Next slide, please. Okay, looks the same. All right, so when you're answering this question, think in terms of your participation in the workshops and what would make the most sense for you and being able to attend, and then as well as the benefits that you see in the way we break this down. So what would be your preferred way of breaking down these topics? Would it be option A or option B? We have right now a 68% vote rate. I'm hoping to get to at least a 75%. Okay, all right, we are almost to 80%. So this one was a close one, and I had a feeling it was going to be close, which is why I wanted to ask this question. So right now, the poll shows 58% would like to break it down by inpatient and outpatient services. And then about 42% would prefer to break it down by substance use disorder and mental health services. Got a few more votes coming in, so now it's about a 60-40 split. And then I want to read through some of these comments that have come in. So if you could scroll up just a little bit. Okay, so all right. So one of the comments was, right now mental health and SUD are so separated. You could have a whole topic area of co-occurring disorders since we are so far from that. And I totally hear that point. Thank you for that. Let's see. All right. Given that integration of mental health and substance use disorder is a legislative requirement, I don't think separating them should be an option in discussing regulations. Yes. Okay, and then somebody chose option A. Okay, and then somebody prefers no more than a 4-hour block per day because doing the whole day is difficult. So I appreciate those comments as well. Okay, so I think that with the voting, we have 60% saying break it down by inpatient and outpatient services, and then we had those 2 comments of support for that approach as well. So I think that is what we will plan to do. Okay, so next piece is, now that we have our topic areas defined, we're going to need to decide which topic to start with first. So again, we're going to address all of the topics, but we do need to have a starting place. And so this pie chart shows the breakdown of those top 25 WACs of concern by topic. So almost half of the WACs that made the top 25 list fell into that general requirements group. The next biggest topic was peer services and recovery support services. I kind of put those 2 together because there is some overlap. And then followed by the mental health services and substance use disorder services that didn't fall into those previous 2 buckets. And then the opioid treatment programs and problem gambling, which those particular WAC sections didn't make it into the top 25 list, but those are topics that obviously we're going to address. So my proposal is that we go ahead and use this information in this pie, the breakdown that is reflected in this pie chart, and that we start with our first workshops focusing on those general requirement WACs, and that's because they impact the largest number of you. And then we would move on to peer services and recovery support services, and then on to the remaining topics. I realize there is going to be some overlap, so while we're focusing we would initially be focusing on those general requirements. We may, when we're focusing on opioid treatment programs, realize that we need to go back and do a little bit more work on the general requirements. So there may be some back and forth and some blurry lines in there, but in general, we would try to stick with, I guess, this order of topics. So here is the next polling question, and this is more of a simple like yes, no. The top 25 breakdown by topic is the way we organize the order of the topics we address, or do you disagree with using this as our framework? Okay, almost to 75. Okay, I think we have a clear preference here. So right now, 95% say go ahead and use this breakdown, and 5% would prefer something different. but I think we have a clear majority here. All right, next slide. Okay, so I think that covered all of the information we needed to collect for us to develop this high-level work plan for how we're going to tackle all of this work. And so I really appreciate all of your feedback and helping think through that and organize it in that way. So that being said, I want to just make sure everybody is aware, as I'm sure you probably are, that there's always potential for speed bumps that are going to impact our work plan. So some of these things that we may run into are things like gifts from legislative session 2020. Behavioral health obviously is a huge important topic, and so I would fully expect that we're going to see behavioral health legislation come through, which could potentially mean directives that Department of Health do rulemaking on certain topics. What we will intend to do and really fight for is that we just be able to wrap those things up into this project that we're doing. So while it may cause us to sort of kind of shift directions for a minute, we will always try to wrap up any additional work into this project that we're about to undertake. There's also sometimes some sneaky unforeseen urgencies or directives that Department of Health may be given, things like, oh, there's a WAC that totally conflicts with the law and you don't have an option, you have to fix that right now. So that's just an example of a sneaky unforeseen urgency. Also, as we're doing this work, we are going to be lifting up a lot of rocks. And there's always the potential for us to find some wiggly things under rocks that we decide need to be addressed before we can effectively move forward. On the flip side of that, as we're working through this and doing all of our great brainstorming and problem solving, we may come up with a brilliant idea that would fix, 95% of what's wrong, and we want to just go ahead and tackle that brilliant idea and implement that brilliant idea and not delay it. And then there's always the human side of it too. I am a human. Everybody in this room is a human. You're all humans, and things happen. And sometimes there's unfortunate capacity issues if somebody has to have some unexpected medical leave or, all kinds of things that can happen. So with all of those things in mind, knowing that there's going to be these potential speed bumps, we're really going to work our hardest and are committed to keeping this project on track, despite anything that may come up if it's in our ability. So just wanted you to know that. And then, okay, so the next steps from here. So Department of Health now has a lot of work to do in preparation for our workshop. So the intent is that after this next session is when we are going to open up our rules to start doing the work on this project. So in the meantime, Department of Health is going to collate all of the comments that we've been receiving, and those comments are coming from the WAC survey. Sometimes they're things that people have emailed us. There are things that we've discovered on our own, our issues. So we're going to collate all of those things and put them in one place so that they are ready to go and we are able to refer to those as we embark on the project. We're also going to do some preliminary research on finding the why. So if there's themes where it's like, well, this is a weird thing that was put in WAC and everybody wants it changed, we're going to find out, well, why was it in WAC in the first place? Is it required to be in WAC because a statute makes us put it in WAC? Is it in WAC because it's a state Medicaid plan requirement? Or does nobody have any idea why it's in WAC and we just need to get it out of there? So we want to try to do some of that preliminary research between now and the time our workshops start so that we're essentially saving ourselves some time and that we'll have the ability to share all of that information with you so that we can all sort of be educated and on this journey together so that nobody's in the dark and everybody really understands and feels comfortable with the rule language and why it is what it is. The other thing we want to do is, at Department of Health, is create a standardized way for our workshop members to review, analyze, and review the WAC language. And I don't know exactly what this is going to look like yet, but what I envision is it actually being like a physical document and sort of this algorithm that we make as a group. We make decisions by running them through this algorithm that takes into consideration the impact to your clients, the impact to you as an agency, and the impact to us as a Department of Health. And I'd like to run every decision through that algorithm and actually document the decision so that we can always refer back to it, and we can use the information in that document to kind of create a guidebook for agencies so they know what the intent behind the language is. So hoping to do that as well. And then we at the department are going to start preparing a starting place for those workshop discussions so that when you show up, it's not just us plopping something up on the screen and saying, hack away at it, that we actually have some clear direction and a well-informed agenda so that we use your time efficiently. All right, and then your assignment, if you choose to accept it, is another pre-work assignment. And if you'll go to the next slide, the pre-work assignment is around participating in the 2020 legislative session. So as I said, I'm sure there's going to be a lot of behavioral health focused bills. And those, again, could potentially impact our rulemaking, either, and it may be that some of the comments that you made in the WAC survey are fixed via a proposed bill or something like that. So it really is important to be knowledgeable about new bills that may be coming through and thinking in terms of how that could impact our rules project and some of the things on your wish list. So you can get involved in legislative session in a couple of different ways. You can just follow along by going to the ledge.wa.gov website, and actually after this call, we are going to be working on putting together some information, kind of like a legislative resource guide to send to you all. So if you're interested in knowing where to find information about bills and bill analysis and things like that, we're going to send that to you in a little guide so that you can easily find that information if you want to follow along. You can also choose if you want to participate. So the bills, oftentimes will have hearings on the bills. Those are open to the public. They are also on what's called TVW, and you can watch these public hearings where people testify in support or against particular bills, and so that's really interesting. And then also, if you feel strongly about something, anybody can testify on a bill. So that's another way to get involved. And then another thing that I'll be working on is a way for you all to inform the Department of Health of the impact of bills. And so I'm working on, so let me back up a second. So Department of Health, oftentimes when there's a behavioral health bill, the Department of Health will analyze the bill and sort of determine what would the impact be on Department of Health. Would this bill, if it passed, would it require rulemaking? What would the impact be on our stakeholders? Those types of questions. And so we've been able to do, one of the questions on the analysis form, again, is how is this impacting your stakeholders? And there isn't, because of the turnaround time and the way legislative session happens, there hasn't really been a great mechanism for gathering that feedback. And so that is one thing before legislative session starts, is trying to determine if there is a good way, an efficient way for those of you who are interested in providing that information, informing Department of Health about the impact of proposed legislation. We're going to try to come up with a mechanism for you to do that. So I don't know what that looks like yet, but as soon as we figure it out, I will let you know, and so that information will come your way. All right. I want to go back to the, see if any new comments have come in, since we are towards the end of our presentation. Okay. Check the time here. Oh, we just have a couple minutes left. So, is there any consideration on this process to develop and incorporate WACs for integrated co-occurring treatment services? This is still a missing piece. Definitely, this is a topic that keeps coming up and is going to need to be addressed somehow. What I'm not sure of is the extent we can address it in our rules, but we are definitely going to talk about it and determine that as part of this project. So yes, we will. I think that there is room to support co-occurring services. We just need to figure out how far we can push it in our rules with the existing statutory authority that we have right now. All right. Okay. Who should we contact in order to provide our input on needed changes? Oh, good. Somebody already answered that. You can, yes, you can email them to me now. If that's related to my question about, or to my information about the legislative session, we will get that information out to you if there's a better way to do it other than emailing me. And when there's a reason a regulation cannot be changed, would it be possible to cite the exact wording and source that was referenced? This was not done in the last revision process, and instead general statements such as it's in the state plan were made incorrectly. I love that idea, and yes, so that form or whatever I called it earlier, where we're using sort of like running everything through an algorithm and documenting the why, that's exactly the thing that I'm looking for, so that it's very clear. The why is very clear and transparent to everybody. So yes. Okay. And I think we have one more question. Okay, so let's go to the next slide. And I just wanted to let you all know I'm super excited. Michelle Weatherly has joined my team. Yay! So it's not just me and Stephanie anymore. Michelle is another program manager, so she will be taking on some of this work and hopefully helping us move it along at a quicker pace. And so I just wanted you to know you may see emails from Michelle coming out via GovDelivery, and so Michelle and I basically were partners. So you will be getting to know both of us very well. And then the next slide is just my contact information. And that does it for the webinar. We ended like exactly on time. So thank you everyone so much